All right, let's take a look at the leg right here. We're going to look at the anterior part of your hip and thigh. And again, with all this, make sure you don't have any kids around when you're looking at this. It can be kind of, it can be kind of scarring. So what we're going to notice is way up here, you're going to see the muscles that are very important as our primary hip flexors. So hip flexors are going to allow your femur to move anteriorly upwards. So when you flex the hip, I want you to think about what happens when you're trying to do like leg lifts and you're moving your leg upwards. Now, if you've ever done ab work where they're, kind of you have to hold your leg up for an extended period of time, or you're kind of like sitting down, right? But you're on your forearm and you're kind of extending your leg downwards, right? These are the muscles we're going to be working on. These are your psoas major muscle. And the psoas major is very, very deep, really deep in the abdominal cavity. And that psoas major comes down and it fuses with the iliacus muscle. And that muscle is going to be on the iliac fossa of our ilium bone. So if these two fuse together, they form this muscle coming downwards. This is the iliopsoas muscle right here. All right, so the iliopsoas muscle is important because of how deep the psoas major is. What happens sometimes is if you have an enlargement of the appendix, you have appendicitis. We don't want to keep pressing in that area where you have an inflamed appendix. So one of the tests that we do is just have you move your leg upwards, your femur up. In the process of moving your leg up, you're flexing these muscles. As you're flexing the iliopsoas muscle, well, the psoas major contracts and it shortens and it gets large. As it shortens and gets large, if you have an enlargement of the appendix, what happens then is you will feel pain in the abdomen just with moving your leg up. All right, so we call that a positive psoas sign. So this is psoas major, fuses with their iliacus, forming the iliopsoas muscle. Now, what else do we see right here is the longest muscle that in our body. This is a sartorius muscle right here. Right? It goes from the anterior superior iliac spine, should sound familiar, and comes to the medial epicondyle of your femur. Now, next, you see the tensor fasciae latae muscle right here. Yep, tensor fasciae latae muscle it starts in that anterior superior iliac spine region as well, and it goes into the IT band or iliotibial band right here. And then the iliotibial band goes onto the lateral epicondyle found on the fibula. Now, you see this muscle right here, this core group of muscles in the front, those are your quadriceps muscles, the strongest muscles of our body. So the quadriceps means 4. It's made out of 4 separate muscles, with the large one over here, and it's very superior, also very medial. This is your rectus femoris. The one that's on the outside is your vastus lateralis. One on the inside, vastus medialis right here. And then all of them insert into our patellar tendon, which goes to the patella, and then you have a ligament that connects the patella to your tibia. That's your patellar ligament. What else do we see here? You see a little bit of your adductor muscles over here, and you see the pectineus muscle over here as well. But in order to see it better, we will going to need to remove some of those muscles so that we can see it slightly better. Now we can see the pectineus muscle right here. So here's the pectineus muscle. And then you start seeing the adductor longus muscle right here. So the adductor longus, again, the adductor longus over here in purple. And then the pectineus right there in purple, one after the other. Now, one other thing we can see, I don't know if we can see a medial compartment, you can see this kind of narrow strap muscle on the inside. This is a gracilis muscle right here. All right, so gracilis, and this one deep, we've removed the rectus femoris. This is your vastus intermedius. So again, right, some of these muscles are very deep. The deep muscles, you have to remove the superficial one. The only way we see this 4th muscle of our quadricep is by removing the rectus femoris. So before the rectus femoris is in the way, can't see it. Once we remove the rectus femoris, then we can see the vastus intermedius right here. the fourth muscle. Okay, rectus femoris, vastus lateralis, vastus medialis, and the fourth one, vastus intermedius. Pectineus, adductor longus, gracilis.